Hi everybody, hope everybody's doing well. Let's do our last spinal anatomy lecture before the midterm. Right, we had embryology, that was this week. Spinal anatomy will be next week. A week from today, actually, next Wednesday. Short lecture today, so won't pile a ton of material on you. Let's just finish the thoracic spine. We won't start biomechanics or the cervical spine. I haven't decided which way we're going yet. But we'll end it right here. Here we go. So where were we talking about? We just finished talking about costal margin last time. Right? And we started talking a little bit about ribs, but we're going to dig into the ribs now. So that's where we are. There's costal facets that makes the thoracic spine quite unique, doesn't it? A typical thoracic vertebrae has 4 small half-circle facets on them called costal facets or costal demi-facets. The word demi means half, right? So it's a half. Sometimes they're not so half, though. Sometimes they look pretty big to me. But there are 4 of them, 2 on each side of the lumbar vertebrae. We'll see those. I think we saw them last time too. Specifically, there's a superior and inferior one. And and these facets have mates on the rib heads. And we'll look specifically at rib heads in a minute, and that's what they connect to. There's also a transverse costal facet as well. We'll look at that as well. So here is kind of a classic picture of a superior costal demifacet, inferior costal demifacet, and there is just a transverse costal facet. And not all vertebrae have these these transverse costal facets, do they? Most ribs, T1 through T9, connect the vertebrae at 3, or connect to the vertebrae at 3 articulation points via 3 facets. There's an inferior costal facet and a superior costal facet and transverse costal facet. T1 is a little bit strange. It's got a gigantic, if this was T1, it would have a very large facet here because the rib head doesn't have to share. It doesn't have to share it with anybody. Nevertheless, it still has 3 on it. Right. Now, here's an important thing. The superior, what rib connects to this, the superior costal facet? That's always the rib with the same number. So if this is T4 or T6, this would be the T6 rib coming in like this. Right? But the rib's going to be big. It's going to spill over and connect to the one above. I think I got a slide. We'll go up above and show you. But the costal, or the transverse costal facet, also has the same number rib connected. So it's really easy. Whenever you look at that or that and wonder which rib it is, all you have to do is know the name of that vertebrae, and that tells you which rib it is. It does connect to the bone above too, which makes it sometimes confusing. Okay, here's an image I shot. And you can clearly see, and we talked about last time, is this a upper thoracic, a middle thoracic, or a lower thoracic? Or how do you know it's even a thoracic? Well, let's answer the first question. It's definitely a middle thoracic vertebrae because it's got that very vertical running spinous process here. And it's definitely a thoracic vertebrae because it's got these facets. Right? Those are the 3 articular surfaces. All right, these are demis, so and that's the transverse costal facet. And these are superior demifacet. Yeah, superior costal demi. I always forget costal. Superior costal demifacet, inferior costal demifacet, and transverse costal facet. What else was weird about thoracic vertebrae? What's strange about them? So they have a big notch right there, inferior vertebral notch. they have no vertebral notch up here. So very strange. All right, so there they are, labeled for you. Now, this is always, look at all the stars here. You're always going to get a question or two on this. Which rib connects to which vertebral body and which transverse process? I kind of told you already, but the superior costal demifacet, I need to add costo in there. But the superior demifacet, costal demifacet, that always connects to the same number rib. Superior demifacet, superior costal demifacet connects with the S for same number, right? So I just explained that to you. Inferior costal demifacet, let me actually make a number. Probably should put costal back in there on slide 46. Head costo. So the inferior demifacet always connects to one up. So inferior means increase by 1. So if you're looking at the inferior costal demifacet of T5, increase by 1, and that'll tell you the rib. So that would be the T6 rib that connects to the inferior costal demifacet. Okay, the transverse costal facet, again, always attaches to its own rib. Here's a nice kind of a see-through drawing where you can see, here's the T7 rib, right? There's the T7 vertebrae, T6 vertebrae. Here's the superior costal demifacet. Down here you can see through. That's connecting to its own. Same. Superior costal facet, superior costal demifacet is same. So that's T7 property. But see how it also connects to T6. So if you're looking at this inferior costal demifacet, you have to increase the rib by 1. You don't say that's the T6 rib. It's got to be the T7. See how that works? And then the transverse costal facet, that's always same as well. So that's the T7 TP, transverse process, and that's the T7 rib. Pretty good. See how that works? Okay, 2 new diarthrodial joints are created. So, right, we just created two new joints. So these are just like, or by the way, what's that? Let's draw the capsule around that. Good, that's a Z joint, zygapophyseal joint or facet joint. When you get out in the real world, it's called a facet joint. When you're in school, it's still a zygapophyseal joint. But that's a true diarthrodial joint. It has a capsule around it. It has a synovial membrane. In fact, a thick synovial membrane that folds inside of it and it can get pinched. These are exactly the same. They have capsules around them, and they have a synovium inside them, and they can get stuck and pinched and cause pain in patients as well. All 3 of these are true diarthrodial joints. Okay, so pretty cool. So we better name them. So we have just created, now why the Cramer doesn't call this the Costovertebral, I don't know. Other books, Standring calls it Costovertebral, but he does call it Costocorporeal. Corporal means body, so I guess it's a little more specific. So that's what I'm going to go with, but just be aware, if they say Costovertebral joint, it's the same thing. And then there's a Costotransverse joint as well. Collectively, the primary motion is rotation is allowed. Rotation of the rib is allowed at these joints. And there's a slight glide involved. We'll do the biomechanics very soon, if not next. You'll understand what gliding is. But there's a upward and downward rotation, and there's some superior and inferior glide that goes on at the joint. But there's not very much because, well, there's a nest of ligaments that we have to look at, and those ligaments are very hampering, so not much motion. Ribs 7 through 10 have a little bit more glide than the ribs above because the Costotransverse facets are a little bit more flat, and therefore the flatter a joint is, the more slip that can occur, more translation can occur over there. Let's take a look at some of the atypical thoracic vertebrae and how they connect to ribs. So T1 is a little strange. I'm not sure if we talked about this, but it usually has a full costal facet, not a demi-facet, but a full costal facet on the superior portion of the vertebral body. Why is it so big? Because T1 usually doesn't share. It doesn't share with C7. Therefore, it's a full facet there. But it does have its own inferior costal demi-facet below, because the T2 rib connects, half of it connects to T1, the other half connects to T2. Okay, that's the deal there. Every now and then you get a demi-facet up here, the superior costal demi-facet, because every now and then you get a inferior costal demi-facet on C7, so the rib can share between the two. So that's not super unusual. Now let's jump all the way down to T12. This only has one costal facet, and for articulation with the rib head, the whole rib, the facet of the rib head. So T12 doesn't share. And another interesting thing is the T12 rib, remember we called that a what? Floating rib. Why? Because it doesn't have any transverse costal facet. So the T12 rib only connects to that facet on the body and nothing else. There's no connection to the transverse process. There's no connection to the sternum either. So it's a floating rib. So that's a little bit weird about 12. 11, kind of the same deal. It has a single costal facet for articulation with the T11 rib. It's full, the T11 rib. We'll look at rib heads in a minute, but it doesn't share. So it also has no costal facet. So therefore, a good, easy softball board question, what two vertebrae in the body only have a single costal facet normally? And that would be T11 and T12, right? And neither one of those have a transverse costal facet either. See how that works? Okay. What about T10? Typically, it has only a single costal facet as well, so it's very similar to T11, but this one's a little more variable. Sometimes T11 has a demi-facet, superior costal demi-facet, because that T10 rib sometimes doesn't share, or sometimes shares between T10 and T9. Sometimes it does, sometimes it doesn't. All right, so it might have if that T10 rib has two articular facets on it, then T10 will, to accommodate that, it'll have a superior costal demi-facet, because T9 is also going to have an inferior costal demi-facet to share that rib head's double articular pads on the rib head. Okay, let's see, in this case T, yeah, we said that. So transverse costal facet may or may not, about 50-50 chance it may or may not be there. So it's kind of iffy. T10 is highly variable, I guess you could say. What about T9? Well, when when the 10th rib does not articulate with the T9 vertebral body at all, when the T10 rib is has only one articular facet, then there will be no inferior costal demi-facet. But if it does, then if the T10 rib does have kind of a double articular pads on it, then it will have an inferior costal demi-facet. So it all depends on the development of the rib or not. But nevertheless, that's the end of the weirdness right there, because it always has a superior costal demi-facet. Right? So that's where we go back into the normal. You good with that? Okay, so there is a, what is that, 11? That's a T11. What do you think of that? Well, we know T11, we can, so if I gave you on the test, if I put this bone on the test, and I said this vertebrae most likely represents T blank, it wouldn't be T7, wouldn't be T6, wouldn't be T1. T1 might have a big demifacet or a big full costal facet here, but T1 would have a demifacet here. This doesn't. Plus T1 would have a transverse costal facet. This doesn't. So this could be either T11 or T12. I didn't get deeper into the transverse processes, but T12 doesn't have a very developed transverse process. It has a short little stubby one. So I could tell this is T11, but I'd be happy if you could tell it's T11 or T12. How about let's look at T1, because I put these on the test before. All right, so why is this T1? Well, it's got two demifacets, superior and inferior costal demifacet, but look how big this one is. This is a normal half demifacet, so this really can only be T1, although in reality we just saw a picture in this slide presentation of a bone that really had a full costal facet, and it wasn't T1. But nevertheless, for our purposes, we're not going to use the weird ones. How about this, T10? Do you agree with that? Could that be T10? Could it? Yeah, it could be. So it's got demifacet here. So that means that's not demi, that's a full facet there. So that means the T10 in this patient, the T10 rib head only has one facet. So it's not sharing with T9. So that could be T10. All right. And so here's a T11 vertebra, a real one. And you can see the big, gigantic, full costal facet here. Do you see a demifacet, or do you see a costal facet, costotransverse facet? Nope, I do not. What if I labeled that? What's that? Number 1. Don't say inferior articular process. That's the facet of the inferior. That's the articular surface of the inferior articular process. If I put back here, this will help you with your lab. If I put it back here, that's the inferior articular process. What if I put number 3 here? Superior articular process. What if number 4 right here? That's the facet of the superior articular process. And then what vertebrae do you think this is? I kind of gave it away, didn't I? Well, there's no transverse costal facet. There's a giant one here, so probably, for your purposes, could be T12, could be a T11, maybe even T10. Let's see how that works. All right, meet the ribs. So typical rib we'll talk about. I'm not going to talk too much about the atypical ribs, but the typical ones we will. It consists of several parts. There is a curved shaft with an anterior and posterior end. This always gets confusing. I might as well cover this right now. So here's vertebrae. This is a posterior to anterior view. Draw a couple of vertebrae. Right, and we have a TP coming out like this on each side. Right, and let's maybe get a different color here. Now we have a rib. So here's the point of this wonderful drawing. So the rib is going to come like this, and it's going to wrap into the plane of the page. We're going to go anterior to the sternum to connect. So I am moving distally. This is distal. So the anterior part of the rib is distal. The posterior part of the rib is proximal. Okay, we good with that? All right. So that's a typical kind of a deal there. The anterior end ends in something called costal cartilage. The rib doesn't connect right into the sternum. There's a kind of in-between tissue made of cartilage. It's called costal cartilage. It's also quite flat, so you can always tell which end is the anterior end and which end is the posterior end. The posterior end has several pieces. The rib head I talked about already quite a bit. It has a rib head, a neck, and a tubercle. A tubercle has a nice facet on it, as we'll see. As you move proximally on the rib, you get a really sharp bend, and that bend is going to be called the angle. All right, let's take a look at some of this stuff in real life here. So here's a real human rib. And tell me which is the anterior end while I take some water here. You got it. I said the anterior end is flat. Which end is flat? That's way flatter. Okay, so that's the anterior end, the posterior end. This whole thing is called the rib shaft. Up to right about here. That's the rib shaft. Rib shaft runs all the way up here. There's a connection for the costal cartilage on the other end of that. We can't see it. There's a little facet for that. But here we got some stuff. There's a big bump. So that's the rib tubercle. This is the rib head, another bump. We'll look at the two articular pads on this. And then this is called the neck, this region right in here. And then you can also see the rib. See where it bends really sharply? Kind of get a nice sharp bend right there. That's called the angle of the rib. Okay. So again, there's the anterior end, posterior end, tubercle. I should have moved the arrow a little more, but this is tubercle. The angle is right here. There's no one spot, but it's about where the rib bends the most. Neck is smooth. We're going to look at ligaments that connect to that neck, and then the head. Good? You'll talk about rib heads being out, and they can be out. There's all sorts of joints right there we need to talk about. So we'll start with the rib head. This is the proximal end of the rib, or the posterior end, whichever you want to say. It articulates with two adjacent vertebral bodies. We've talked about that. The most ribs, not all of them do. Sometimes the rib 12 and rib 11 and even rib 10, they connect with just one body, so they only have one costal facet. But run of the mill, most of them have two articular pads on them. Why do they have two articular pads? Because they connect to two bodies, two costal demifacets is what they connect with. Demifacets match the superior and inferior articular facets on each rib head. We'll see how that works in a second. There is also, so here let's just draw a rib head here, kind of looking straight down, then the rib would kind of go off like that. So there's a nice pad right here. So that's an articular pad, and there's another articular pad or articular facet. And then in between them we have a ridge, a crest of bone, which is called the crest of the rib head. We'll learn that this actually is attached kind of indirectly to the intervertebral disc, which is a really weird setup. But that's what the rib head looks like. All right, let's look at a better picture than mine. So here's the tubercle region. I mean, they can include this. They probably should have said from about here to here is the tubercle. This region between here and here would be the neck. The drawing's a little messed up. Okay, neck doesn't do anything exciting, doesn't articulate, but that's where some 2 or 3 ligaments that connect there we'll talk about. Not sure how, I can't remember how deep I went into it. Okay, but here's the crest that I just drew. Okay, so here's the superior articular facet. Guess who that connects to? That would connect to the inferior costal or inferior costal demifacet. So that's a little weird. I'm just going to call these, I'm getting too specific here. Let's just call these just facets. There's 2 facets on the rib heads. We won't, because that's going to get too confusing. I think that's getting too deep. Definitely know what the crest is, though. If you got one of these double faceted rib heads, it's going to have a crest in between. And then we're going to look at a ligament that comes out and actually attaches to the intervertebral disc. Gives a little support. Disc herniations in the thoracic spine are really rare. Well, they happen, but symptomatic ones are quite rare because there's so much extra stuff connecting to those discs, especially laterally. All right. Make a note about 63. I think it's getting too deep. Too deep. All right, now here's just another real one. There's the neck. And you can see the tubercle looks a lot better in this real one. There's the head of the rib. The neck of the rib is located between the head and the tubercle of the rib. It's the attachment point for 2 ligaments, key ligaments, the Costotransverse ligament, and then the superior Costotransverse ligament. There's actually 2 bands, an anterior and posterior band of this. That's why I was saying there's 3 ligaments. I don't know, that might be getting too deep though. So really technically there's 3 ligaments that connect there, but one of them is double banded. You'd have to read how the question was. Then the tubercle, we talked about that. It's a process that forms on the lateral boundary of the neck, right at the beginning of the shaft. Okay, we've seen that. It has an articular facet as well. And that one articulates with the transverse costal facet. Okay? The same number, in fact. So how would you name that? If I stuck a pin on this, what if I put number 2 right here? You can see the facet. Actually, the facet is on the other side. But if it's on the smooth surface, the facet or articular facet, then you would have to say the articular facet of the rib tubercle. Don't forget of the. Also contains a non-articular part, which gives rise to a very short and powerful muscle or ligament called the lateral costal transverse ligament. Shaft, okay, so shaft begins immediately distal to the articular tubercle. Where was that again? So there's the articular tubercle, so the shaft would start right here. And there's the shaft. Good. Tubercle, neck, head of the rib. All right. And extends distally all the way to the anterior rib where it meets the costal cartilage. The shaft includes the angle of the rib. The angle is part of the shaft where it bends. So curvature, we talked about this a little bit. Wait, tell me now which way's, I kind of ruined it. Which way's front? This is flat, so that's always front. Flat, F for front or anterior. You can see the angle quite nicely. There's no sharp curves until you get right in this region here, so that's the angle right there. So ribs typically curve inferiorly and anteriorly from proximal to distal. Much of the curve occurs at the angle, as you can see right up above. The angle is located a few centimeters distal from the articular facet. Really it's distal, exactly distal from the tubercle. I don't know why Cramer said a few centimeters, because the tubercle contains the articular facet, but that's just the way he decided to say that there. Okay, costal groove is another important one. I always have trouble getting pictures of these. They're hard to see. So It is a groove that's dug into the rib, and you can see it on the real ribs. I have to work on getting a picture for this thing. But it always tells you it's on the inferior part of each rib. Sometimes it's hard to see. The key that boards and everybody likes is that rib on the back side. You can just see a little bit of the groove here. But there's a neurovascular bundle that runs in here. In fact, the intercostal neurovascular bundle runs here. And they're always in this order. From superior to inferior, the mnemonic is VAN. So there's the intercostal vein on top, the intercostal artery in the middle, and the intercostal nerve down on the very lower part. This is why when you're in medical school, when you put a chest tube in, you never put the chest tube touching the bottom surface of the rib, because you could injure the intercostal nerve. You always palpate the rib below and slide the chest tube right down there. And that way, see, there's nothing on the superior part of the rib to injure. So that's where the chest tube goes, right there. So you don't injure that intercostal nerve. The patient have a horrible burning neuropathy type pain, right? Have pain burning all the way around his rib because of that, right? If you want to, some people use the mnemonic NAVE. It's another one. If you're like to go from inferior to superior, intercostal nerve, intercostal artery, intercostal vein. Let me show you another thing while we're here. I do like my anatomy. I won't teach that much anymore, though. I'm just got too many classes. And let me get rid of this. Here's another important thing. I find students always confused with this. So this is an A to P view, right? The little man's looking at us. There's the man looking at us. So there's 3 layers of muscle. Also, when you put that chest tube in, you have to pierce 3 layers. And then you have to pierce the parietal pleura, is the 4th layer down. But nevertheless, there's an external intercostal muscle, which you can see the fibers run more kind of lateral to medial. Underneath that, there's an internal intercostal muscles. Fibers tend to run more the opposite direction. But sometimes it's really hard to tell the internal intercostal from this. That's the innermost intercostal muscles. So how do you tell the internal versus the innermost intercostal muscles? You look for the neurovascular bundle, because the neurovascular bundle always runs in between these 2 muscles. So that's how you can tell where you are. So always look for that when you're in the cadaver lab. You can see that nerve sticking out there, right? So bad to stick a chest tube right there. The little sharp thing that goes in first would destroy that nerve, right? So make sure you palpate the superior portion of the rib and put it in there. Chiropractors, of course, are not going to be doing that. Atypical ribs. The first rib is really weird. It's the only one I'm going to really talk about. It is, because we talked about some of the atypicalness of T10, 11, and 12. They don't have a crest. Here's that view of the rib head. They don't have that crest. If we look at the kind of long end of the rib, they'll just have a giant facet here. And that matches the costal facet on T12, 11, and 10. But rib 1 is interesting. First of all, it's got a full costal facet. It doesn't have a superior costal demifacet. We said that. But the shape of it is weird. It's very short, and it's very flat, and it's very strong. It lies almost completely horizontal in the body, which is weird. It's not angled inferiorly like most of the ribs are. And its superior surface actually has a nice muscle attachment for the scalenus anticus, or the anterior scalene muscle. And that's called the scaling tubercle. So you can always tell the rib. And unfortunately, I left a took all my bones home so I could shoot pictures of them, but I forgot some of the ribs, so I didn't get that one home. I have to show you a picture of it. But here is an A to P view. A to P view. So again, man's A to P. There's the man. Here's his rib. Here's the sternum right here. So really weird, right? It's not round. Still has an angle right here. Still has a neck. Still has a tubercle. Still has a head. The head's only got one facet on it. It doesn't have a crest on it. And it's got a big bump. And it's usually a pretty good sized bump right there. And that's the scaling tubercle. So you can always tell that first rib. All right, costovertebral articulations. So the ribs, as we said, they articulate to the vertebrae. That gives us two new joints. And collectively, those joints are called the costovertebral joints. Oh, okay, I see. I just light bulb clicked on with me. Costovertebral joints is the main category, so that shouldn't be an AKA. So that's Cramer's correct in that. So it is Costocorporeal. So the costovertebral joints have two subcategories: Costocorporeal, Costotransverse. All right, so these slides are all brand new. So I just got this class 3 quarters ago. So I'm slowly building it up. So let's look at these two articulations. We said they're diarthroidal joints. I need to go back and change that AKA then, don't I? I can't remember where that was, but I'll fix that before I upload these slides. Fix AKA for costovertebral. All right, let's look at costocorporeal, because corpus is body, so that's where that comes from. So it's the joint between the rib head facets or facet and the costal facets or facet, depending. But it's the joint between the vertebral body and the rib head, I could say. It's a true diarthroidal joint. Has a capsule, has a synovial fluid. It even has synovial folds. I said synovial membranes are kind of prominent inside, like the Z joints. Even in these costocorporeal articulations, they're quite prominent as well. And they can get pinched and cause pain in people. Actually, that's one thing. Chiropractic's pretty good for people who have these rib misarticulations or subluxations or fixations. Okay, so similar to the Z joint, let's take a look. Here's a overhead view or axial hat or chat, right? Cross-sectional, horizontal, axial, transverse, all AKAs. Drives you crazy, doesn't it? And so this is a cut not through the disc, but cut right through the body. So you can see the costovertebral joints right here. So that's the facet of the rib head meeting the costal demifacet here. I'm not sure if it's superior. I think it looks like superior to me. But it's one of the costal demifacets. And then back here you can see kind of in a different plane, we have the Costotransverse joint hooking up with the facet on the rib tubercle to make another Costotransverse joint. Okay, and we'll talk about all these ligaments here in a second. So cool, we got two new joints. Now the Costotransverse articulations, they're made by, as I just said, the facet on the costal tubercle and the transverse costal facet. These are not seen for sure at T11 and T12. These are also true diarthroidal joints. They have a capsule, they have synovial fluid, they're the real deal. They have a fold, a synovial fold, just like everything else. All right, almost done. So let's do some ligaments now. And these are not a lot of fun, I don't think. It gets confusing, but I'll try to make it as painless as possible. So they arise, let's talk about this one first. So this is the lateral costotransverse ligament. This is the easy one to start with. It simply arises from the lateral tip of adjacent transverse processes. It's short. It's really stubby. And it connects into the costal tubercle on the adjacent rib. So it arises from the lateral tip of the transverse process. It courses laterally and joins the non-articular region of the costal tubercle. So this is not, it can't join the facet, right? The facet is already joint to the transverse costal process. Okay, so let's take, here it is right here. Picture's better sometime. So it arises from the lateral tip of the transverse process, and it digs in to the costal tubercle, but not the articular portion, just the bony portion of the costal tubercle. We good? So that one's pretty easy to see. There's another one, and another one. You can see these on, when we had a cadaver, you could see them on the cadaver quite nicely. Next one is the superior costotransverse ligament. This is a double. It has an anterior and posterior laminae. This courses between the neck of each rib. So it rises from the neck. And it inserts into the transverse process of the vertebrae above. So both parts course superiorly from the neck, or from the rib's neck, to the inferior border of the transverse process immediately above. See if you got a nice picture of these here. You can see these on the your lab worksheet, where that was yesterday. But yeah, there they are right there. And there's the anterior, posterior laminae. You can't really see, posterior is behind this one, but that's the superior costotransverse ligament. Okay, accessory ligament. So this is a little ligament. So it also rises from the neck of the rib, just medial to the superior costotransverse ligament. It anchors the inferior articular process, or anchors into the inferior articular process. So this goes all the way into the spine. And this one is important. Let's take a look at it. There's the accessory ligament right here. See the little guy? There's another one right here. Superior costal transverse ligament is outside of it. But look, we got a little hole in there, don't we? Take a wild guess what's coming out of there. Ventral rami is coming out of there. So not only do you have a foramen, but you have another little tunnel made by these things. Okay, that's the accessory ligament. So posterior, aka ventral ramus, comes out of there. Remember Cramer, watch out for this. I don't like this. Posterior primary division, he calls it. Remember I said I don't like that because down it gets confusing in the lumbar plexus and the sacral plexus. You have the posterior ramus splits into division, anterior and posterior division, so that gets confusing. So Gray's Anatomy, both Gray's Anatomy books uses posterior ramus. So I wish he would stay with that. Nevertheless, because there's some of the neurology books use the same thing. All right. So here's just a blow up. So ventral ramus passes. I didn't draw it, but we could have drew it coming right through here. Kind of like transforaminal ligaments we talked about. Goes right through there. Then there's an intra-articular ligament. So this one is the one I said that comes off the crest of the rib head. So you have to have a crest. So you're not going to have this down at T12 or T11 or probably T10 either, because you have to, and even T1. But if you have a double articular surface with a crest in between, then you're going to have an intra-articular ligament extending off of that, and that thing digs right into the intervertebral disc. Did I say that? Yeah. In the rib to the intervertebral disc. It has two components we're not going to get into. But, I mean, all these ligaments secure these connections. Okay, here's an easy one to see. Even on cadavers, you can see it quite nicely. This is called the radiate ligament because it looks like it's radiating out. It arises from the anterior part of the rib head here, and it just connects into kind of a perimeter around the costal demifacets or costal facets. They all, even the T12 and 11 have it. And you can see it's just kind of digging in there. It inserts into the vertebral bodies, surrounds the costal demifacets or costal facets. And some of the fibers dig right into the intervertebral disc as well. So it's another supporting. The posterior lateral corners of the disc can be supported, and the anterior lateral corners can be kind of beefed up with this one as well. Okay, costotransverse ligament. So it's medial to the superior costotransverse ligament, but it passes from the posterior part of the rib neck again to the anterior proximal portion of the transverse process. So it's a little closer to the vertebral body, still off the transverse process. So here's the costal transverse ligament running right here. Okay, there's another one up here. All right. Remember what this one was? Good, that's the superior costotransverse ligament. Here's an intertransverse ligament. And I should mention that reminds me, I'm not going to cover all the other ligaments, but all the other ligaments we talked about in the lumbar spine, they run through the thoracic spine as well. I'm just not going to repeat them. There's an anterior longitudinal ligament. There's a posterior longitudinal ligament. There's a ligamentum flavum. There's an intertransverse ligament. There's a there's a interspinous ligament and a supraspinous ligament. And there's intertransverse ligaments, like we just saw right here, intertransverse ligament. So on top of that, we have all these new ligaments. So these are in addition to. Right, here's just another picture kind of showing the superior costotransverse ligament runs here. This is not the greatest view to look at this, but if you look overhead, you can see the costotransverse ligament here. Lateral costotransverse ligament back here. Okay, there's some little there's the intra-articular ligament here. We said that connects the crest to the disc. And these are true dorothyroidal joints. They're showing the joint cavity. There's a synovium around there. And yeah, real joint can cause pain, has nociceptors in it. I think this one comes from your lab handout, but we'll go through these. There's the intertransverse ligament. Nothing special about that. That goes all the way down. But there's the superior costotransverse ligament here. I guess the other ones are there. The radiate ligament is there. And they cut the lateral costotransverse ligament because we took out the ribs so you can see the superior costal demifacet, inferior costal demifacet, and transverse costal facet here. All right, so we'll keep it short. We'll cut it off right there. There's a lot of material in there. You're probably not familiar with this stuff. So, all right, remember, we'll start next Tuesday. We'll probably start biomechanics. Because I don't want to put them all at the end, because we haven't done the cervical spine, which is fun to do. But we got some other work to do. So we'll probably do biomechanics. We have a little neurology to do as well. But that next Tuesday lecture will not be on your test, which is Wednesday, right? So next Wednesday, week 7 is your test. All right, see you guys later.